Hi friends, this is the case of a woman who has come to us with a 3-month history of recurrent hemoptysis. Along with it, there's the presence of constitutional symptoms like cough, malaise, and weight loss. She also happens to have a past history of tuberculosis, which was diagnosed at the age of 19 years, and an ex-smoker. Based on all of this clinical profile, when you look at the chest X-ray, you'll be finding that there's an opacity present in the right upper lobe of the lung, which has a narrow crescent of air in it. This crescent or sickle-shaped air, which is present in opacity, which is present in the upper lobe of the right lung, is what we characteristically call as the Monod sign. And what is Monod sign seen in? Monod sign is seen in Aspergilloma, which is basically also commonly called a fungal ball. So in Aspergilloma or a fungal ball, what usually happens is whenever a patient has been a past history of tuberculosis, inside the cavitation that has been created by the primary tuberculosis, which was diagnosed at the age of 19 in her case, Aspergillus fumigatus, which is a fungus, tries to colonize that area and creates its own home. It's like you have a home where you used to stay. You have left that home and you've kept the gates open. So somebody else has come in, colonized your home, and is now staying in that and claiming that this is my place to stay because I'm getting shelter, I'm getting food, everything. So basically, Aspergillus fumigatus colonizes the area of cavitation that is left by a previous or a past history of tuberculosis. That is what shows us the opacity and the narrow crescent of air in it, which is sickle-shaped and hence also called the Monod sign. Now, what is the treatment? The treatment is usually surgical excision. Usually these are not very, very dangerous. They won't lead to massive hemoptysis. However, some rare cases of massive hemoptysis arising out of a large Aspergilloma, I repeat the term, large Aspergilloma, has been recorded. So that is usually the case that we have in this question. Ruling out the other options, number one, it cannot be mesothelioma. Mesothelioma is most commonly associated with asbestos exposure, and it will come more as plaques or pleuritic plaques along the pleural borders. It cannot be a reactivation of the tuberculosis again, because I understand since she has been a past history of tuberculosis, there's always a chance of reactivation later in life. But a reactivated TB will almost always come with a cavitation or a consolidation. So the absence of cavity, the absence of consolidation rules out a reactivation of the TB again. And lung abscess, no, it cannot be lung abscess. There is no fever. Lung abscess would be a very acute presentation. There would be air fluid levels in the chest X-ray. You would not find an opacified area with a narrow crescent of air. So all of this rules out the other options, and hence our option, the correct option to go with is Aspergilloma or the fungal ball. Thank you so much.